Hello, my name is Saadia Yunus. I'm a licensed marriage and family therapist, and today I'm going to talk to you about the CBT tool, Challenging Anxious Thoughts. CBT is cognitive behavioral therapy. This tool will help you to challenge those anxious thoughts that really lead to more anxiety. Anxiety is really a healthy emotion in a lot of ways. It helps us to focus on what's going on, to really prioritize things, and to problem solve. But unfortunately, it can oftentimes have us thinking really irrational things that takes away our ability to problem solve. In this tool, you will need a paper and a pen, and we will start challenging those anxious thoughts. So I want you to think about an anxiety-provoking situation, something that triggers your anxiety. It could be being around a certain person. It could be speaking in front of a crowd, getting behind the wheel. It could be anything that triggers your anxiety. Write that situation down. You think about it. It's something that triggers that anxiety. And immediately when our anxiety is triggered, thoughts start to race, right? We start to think about this situation and what could possibly happen. Because anxiety distorts our thinking. It makes us focus on the worst case scenario. And so that's what I want you to do in the second part of this tool. Write down what is the worst possible outcome in this situation. You know, whatever that situation was that you wrote down earlier, what is the worst likely outcome? And anxiety usually takes us there. What is the best outcome? And then what is the likely outcome? So write these three things down. That anxiety-provoking situation, the worst outcome, the best outcome, and the likely one. And if we're thinking about, the example I gave of speaking in front of a crowd, the worst likely outcome might come out to be, completely messing up and tripping, and people laughing. The best outcome would be a standing ovation. And then the likely outcome, I speak in front of a crowd, I try my best, maybe make some mistakes, but overall do okay. We were talking about challenging anxious thoughts. This is challenging the irrational thoughts that sometimes immediately come to mind because the fear is involved. Okay, so now that you've written this, we go to the next part. If the worst possible outcome, the worst case scenario were to come true, okay? So whatever you wrote down as the worst case scenario, if that were to come true, would it matter? Would it matter 1 week from now? Would it matter 1 month from now? And would it matter 1 year from now? So write these things down. 1 week from now, 1 month from now, and 1 year from now. And then put a yes or no if it would matter. So what you're doing here is you're challenging that anxious thought that is the worst case scenario. And then the last part is now to write down rational thought and irrational thought. So what was the irrational thought that you had in this situation when it comes to that very first step of the anxiety triggering situation? What was the irrational thought? And the irrational thought is usually that worst case scenario, that things will horribly go wrong and everybody will laugh and I'll never see the end of it. There's a lot of always and never and couldn't possiblies, and usually those are signals that this is an irrational thought. And then also write down what is the rational thought. And the rational thought in the situation that we talked about was things will be okay. So write that down and I'll give you a moment. What was the irrational thought and what was the rational thought? And this is the end. You have successfully challenged that anxious thought where anxiety will take us to the worst case scenario and it isn't even likely. And so now that you've done this on paper in these steps, You can do this in your mind on a daily basis. When anxiety starts to creep up, challenge it and ask yourself, is this really likely? Or is this my anxiety telling me this irrational way of thinking? I hope this tool was helpful for you and you understand better ways to challenge anxious thoughts, and I hope you have a wonderful day. Take care. Bye.